Oops. All right, so here we go. So assumptions underlying the intervention wheel 1 through 17. So assumption 1, defining public health nurse practice. Promoting and protecting the health of populations using nursing, social, and public health sciences. Public health nursing is education in both public health and nursing, and the primary focus is health and disease prevention for entire population groups. So that was the first assumption. The second is public health nurse practice focuses on population. So we focus as populations as opposed of the individual, right? And it's not just populations like Cincinnati, but also the homeless population, pregnant women, the elderly, children, children with disabilities, hearing impaired, immigrants, refugees, African American, are Latino, those who just by socioeconomic status and statistically have lower access to health care, those who are illiterate, those with drug abuse symptoms. There's all these populations and subpopulations, and we look at populations of risk and populations of interest. And risk and interest vary historically, and also based on what are current concerns. So public health nurse practice considers determinants of health. So there's, social determinants of health. What contributes to people accessing health or actually having what we consider a healthy life. So there's health inequities, right? So those who are born at a disadvantage, maybe you have an autoimmune disorder, HIV, substance abuse is a determinant of health. If you drink, if you're an alcoholic, your immune system is low, so you're at risk for more diseases. Then there's United States inequities like race, gender, age, socioeconomic status, and then other determinants of health like literacy, education on health. And then assumption 4, priorities identified through community assessment. So this week, week 4, you're going to be doing a windshield assessment. You're going to be looking at your community and identifying objectively aspects of the healthcare in the community, and then other aspects, right? So like, do you have stop signs? Do you have crosswalks? And then doing community assessments within each problem that you might identify as a priority. So it's an ongoing collection and analysis. Most communities have some form of a health department or someone tracking disease, at least in the United States. Now, it might not be apparent, like where I live, it is, right? We have a local health department, and we also have a statewide, and it's pretty active and visible to the public. But also, like, local hospitals will track issues because, for example, in the early 2000s when there was a lot of meth issues, the methamphetamine, people were making it in their cars or in farms and stuff. It was definitely more pervasive in certain areas of the country. So Iowa had a huge methamphetamine problem compared to maybe South Florida. Now, South Florida might have had other issues, like in the early 90s, they had a large HIV epidemic that Iowa didn't have. So, these priorities cannot be set at national levels. Sometimes they're set based on a community's needs. And then you identify gaps between needs and services. So, there was a place in Indiana, I think it was like 6 years ago, where they kept having large outbreaks of HIV, and it was all through sexual contact. And there was a need in sexual education in this area. And they were able to catch that by performing these community assessments. And part of that's involved with epidemiology, which at a higher level of public health course, you will learn more about. We will touch on it slightly in this class. If you're ever interested in talking about it more in depth, you can contact me because it's kind of my wheelhouse. So assumption 5, emphasis on prevention. So we've talked about there's 3 levels of prevention: primary, secondary, and tertiary. So primary prevention is actual prevention and promotion of health. So prevention of disease, promotion of health. So this is for people who don't have the disease, and it's to prevent it from coming on. So And every different type of issue that you're looking at is the level of prevention looks different. So, primary prevention in diabetes is, not screening for diabetes, right? Because that's trying to find it in early stages. It's educating people to exercise and eat well. Whereas secondary is trying to find in early stages, so that's where you do the early screening. And then tertiary is more aggressive screening, or maybe finding it before it becomes a worsening crisis. So amputation or dialysis, okay? So always aim for primary prevention when possible. Of course, that's not always the case, right? If you are trying to prevent teen pregnancy, screening for sexual activity is a secondary prevention because you're trying to find early stages of, unsafe sex, versus primary, which is, more education based. And then tertiary is like, okay, well, people are pregnant, and now we need to talk about ways to maintain a healthy and safe pregnancy, or options for that. And so, like I said, every level of prevention is different for every single type of problem you're looking at. So although not every event's preventable, every event has a preventable component, right? Death is not preventable, but a healthy death is definitely something you want to talk about. Or preventing an expensive death, in a sense that, dying of heart failure in the ICU versus, dying of old age, in a healthy, non-painful way. So assumption 6 is public health nurses intervene at all levels of practice. And like we've talked about, we work at the individual level, we work at the systems level, and we work at the community level. Sometimes it's simultaneous, and sometimes it's sequential. Assumption 7, public health nurse practice uses the nursing process at all levels of practice. So remember the nursing process: ADPI, assessment, diagnosis, planning, implementation, and evaluation. Public health nurses must customize the process to the 3 levels of practice. So, when you're writing nursing interventions like at risk for circulatory issues secondary to elevated blood pressure, when you're looking at that at the individual level, it's much different than when you're looking at the community level, right? Assumption 8, public health nurse practice uses a common set of interventions regardless of the practice setting. So when you look at the 17 interventions, go back to the wheel. So here are the common interventions, okay? And they're going to be at any level, at any place. I know this is darkened out, but it does eventually trickle down. So red, green, and blue, everything's color-coded, individuals, family, classes, and group. And then orange and yellow looks at systems and communities. So red wedge is about surveillance, disease, and other investigation, outreach, and screening. So when you look at these 4, this is a lot of that epidemiology. I would hazard if you went and spoke with maybe your hospital group or your local health department, they have constant surveillance. So for those of you, maybe you live in like Gary, Indiana, look up your health surveillance. That's just about Gary, Indiana, and it's going to talk about all those issues. And then you're going to talk about disease and health event investigation. So one thing is, there's reportable health events all the time. So people who die of environmental issue or get injured. So maybe there's for those who work in an industrial area, and they're looking at health events that are related to industrial accidents. And they're looking at that to decide whether there needs to be more occupational health. Cincinnati has a high rate of syphilis, so there's a lot of disease events of congenital syphilis. So we have surveillance of that with disease reporting, but we also investigate how we can prevent that in the future. And that's where you have screening and outreach. And so you see, it looks at it for case findings, and those case findings can be applied to the individual, community, and system level.